It is a very, very cold morning. I am very shocked that my producers, Tyson and Havis, are not putting on sweaters, whereas, well, no, some of us are in sweaters, but it's really, really cold outside. It's going to rain cats and dogs. Just in case you're coming to town, please make sure you carry a sweater or carry a heavy jacket, because we have gone into these rainy seasons, and I want to say people who are built in wetlands, this is a time to know ani akuguza ploti, and you start finding means of, you know, vacating so that the rains do not do you bad. But a very, very good morning. Welcome to this session of One-on-One. My beautiful name is Sheila Kahunda, and of course I'm your host today. And today I'm honored and glad to have Sister Anne from Chisubi Referral Hospital. We're going to be talking about pregnancy, or we'll be talking about antenatal or maternity. There's a lot that we need to know as, you know, mothers that are out there that are expecting. Very many things that you need to know. What are the do's and don'ts of when you're pregnant? What is pregnancy, first of all? How do we conceive? What do I do when I conceive? What kind of food am I supposed to eat? Do I have to go to hospital? Well, long time ago, before actually not even my mother, our judges would give birth from, you know, from the villages. But this is the thing, they had very good midwives. So they would tell them what to do and not what to do. These days, you find pregnant women still putting on a 20-inch shoe. So those things, Sister Anne is going to be telling us, what can we do? What are some of the things that we are not supposed to do? And also, someone sent in a question to ask and said, what could be morning sickness? Well, all that is going to be happening, because Nino Mukugu, I have a midwife. She's going to be telling us how did she earn the title of sister. I normally see the sisters in Mulago Hospital that put on the red belts, and some of them put on a hat. Those are the ones that I know. But Sister Anne, you're welcome this morning. Good morning.
Good morning, Sheila.
Good to see you.
Good to see you too,
Our
dear.
viewers now would want to know your name.
My name is Anne Nachijoba. Just like Sheila has said, I'm a midwife, and I'm a practicing midwife working with Kisubi Hospital currently. And just like Sheila has said, mothers out there and those who are preparing to become mothers, today we are here for you. Thank you, Sheila.
Okay, sister, how did you earn that title of sister? The ones that I know, I see them in Mulago Hospital, the ones that put on a red belt. Do you also wear a red belt?
Yes, I actually put on a red belt. And the title of sister, we have those titles in nursing, yeah, and it depends on the level of education in nursing, yeah.
Okay, that is very interesting. So, sister, what is antenatal care? Someone out there would want to know, what is antenatal care?
Okay, thank you, Sheila. Antenatal care, this is the care that is given to a mother and their babies when they are still pregnant. And antenatal care is targeted to see that at the end of the journey, we get a healthy birth. Of course, during antenatal, we want to see that the mother is having a non-problematic pregnancy, yes. So that at the end of the day, the mother and her baby are getting a good outcome. So basically, that is antenatal care. Yeah.
So now I think now people know. And when should a woman start antenatal? Because these days, people, very working class women, don't have time for that. Ugamba nagenda, njagenda, things like that. When should one start antenatal care?
One should start antenatal care immediately you get to know that you are pregnant. It would actually be good to prepare even before you become pregnant, because there is what we call prenatal care. You start taking your folate like 3 months prior to conception, so that you prepare the environment of the pregnancy and the quality of the egg. So, but in case you're not able to do the prenatal care, it would be good immediately you get to know you're pregnant, you walk to a health facility and to a health professional so that you start antenatal care. Yeah.
How many should I ask? How many antenatal cares should one get?
They are actually, Sheila,
Many?
they are called antenatal visits.
Yes, antenatal visits. Thank you very much. So how many should one get?
So the recommended ones by WHO, that is World Health Organization, and the Ministry of Health are 8 visits. Yeah, at minimum, and that is for a normal pregnancy.
Do we have an abnormal pregnancy?
Yes. There is what we call abnormal pregnancy and maybe what we call the abnormal midwifery bit of it. Yeah.
Do you mind explaining to us?
Okay, yeah. So for the normal pregnancy, we expect this mother not to have any issues during this time they are pregnant or any complications. Yeah, they only have what we call the minor disorders of pregnancy, morning sickness, and all that. But this is a mother who is just like any other person. They will just come. They are not complaining of anything. That maybe I'm having a headache or maybe I'm having, any discomfort. Yeah, they just walk in. You see them. You do what you have to do. You do your screening and all that. And when you do the screening, everything is normal. You give them the supplementation and then they just walk home. So normally, those mothers are expected to fall within the 8 visits. And what we call the abnormal, these are mothers that are having complications, or maybe they already have complications. For example, they have in their past, they have maybe previous illnesses, medical illnesses, obstetrical history, which is not good. Yeah. For example, they have been pregnant before and their pregnancies have been difficult. Yeah. For example, they've had premature deliveries, they've had high blood pressures, what we call preeclampsia. Yeah. So now that goes into the abnormal midwifery or the abnormal bit of it, and we come to categorize them as high-risky mothers. Yeah. So for those ones, we don't see them as the other normal mothers
who just walk in.
So in most cases, you wouldn't expect such mothers to fit within the 8 visits, because they can come to the clinic today and then the next day you see them come back again when they still get other issues. Yeah.
You talked about morning sickness. What is morning sickness in a pregnant mother or in an expecting mother? Because they categorize morning sickness as, very many things. That maybe someone will wake up with a headache. Well, someone will wake up maybe not eating. Maybe someone is... What is morning sickness, sister?
So morning sickness, now we want it to, let me take it up from here so that people can really get it. When somebody conceives, the body is getting something new. Yeah. So something new has been introduced into my body. Here I am, for example, Sheila, where you are. I have been Sheila and it has been me and myself. Yeah. And now there is somebody else who is now coming into my body. Yeah.
A foreign body.
Exactly. So my body is like, what? What is not happening? What is this? Yeah. So as a way of reacting back to all that is happening, yeah, so we shall get such symptoms. For example, you can feel like
you're nauseated.
You can feel like you're weak. Your body is entirely weak, most especially in the morning. You feel like you don't want to wake up. You feel like you don't want to do anything. Yeah. Some mothers go ahead and vomit there is that bitter,
Yes, then you say, oh, well,
vomitous.
I think I have musujja.
Exactly. So some mothers tend to call it musujja because it usually happens very early in the morning and sometimes in the evening, and then you feel like you're cold, you feel like you want to cover yourself, yeah. So that is basically morning sickness, because now the environment is trying to adjust to something new into your body, yeah. So that is when you get such signs and symptoms. And in midwifery or in obstetrics, we say morning sickness is normal. So when a mother tells you about that and you actually go ahead and screen them
and you find out
and confirm that actually there is no any other issue, for example, there is no malaria, there are no UTIs and all that, you just cancel them and let them know that actually this is morning sickness and all shall be well. And maybe to wrap it up, usually these symptoms occur in early pregnancy.
Sister, what is early pregnancy?
Early pregnancy, that is the time of conception until 12 weeks. That is what we call the first trimester.
Are those the most dangerous trimesters in a woman?
Exactly. Those are the most dangerous and very critical and very crucial moments. Because in the first trimester is when development of the fetus is happening. So most of the body organs of the fetus are now forming. So that is why we say as soon as you get to know you're pregnant, please walk to
a healthy center.
A health center, so that you see a qualified professional. Because at this stage, we don't want to miss out anything. We want to prepare the mother as much as possible to see that we get good outcomes. There are do's and don'ts in that trimester, yeah? When it comes to what we eat, the type of medicines
that we take
in. Actually, self-medication is not recommended, but at this rate, when a mother is pregnant, it is even not at all recommended.
Are those the first trimesters, let's say from, the time that you conceive up to, like, let's say 12 weeks? Are those the times that a woman can get a miscarriage?
It's very possible. Though, it may not only be at that stage, even at a later stage.
Oh.
A woman can get a miscarriage, yeah? Because there are a lot of things that can happen for a mother to get a miscarriage, yeah? But they are more prone to these first stages. What are the do's and don'ts of, or to do when you're in the first trimesters, basically? Because when you talked about the first trimesters, it seems like they're the most critical, stages. What are the don'ts and do's of the first trimester from the time that you conceive up to about like 12 weeks? What are the do's and the don'ts? Now, for the do's, one we have already mentioned, as soon as you get to know. To a healthy facility. That is one. Then two, we expect a mother to get supplements as recommended by a health professional. Yeah. There are certain supplements. For example, we have been talking about folate. Yes. Yeah. So folic acid at that time is very crucial for brain development of the fetus and then the spinal cord. So we wouldn't want to miss out. Yeah. Then two, we need to screen this mother for any other illnesses, yeah, so that we can intervene as soon as possible, yeah. For example, at this stage, if we are screening the mother, we need to know their serostatus. Oh, is it important? Very, very, very important. Serostatus is very, very important. Why? There are some mothers who don't want their statuses to be known. That is why we are here to let them know the importance
of antenatal
care and of them knowing their status.
statuses.
Yeah, because if you don't know your status at this rate, just know even the baby you're carrying is at risk
of getting a disease.
Yeah, because getting a disease can be intra-utero when the mother is still pregnant, at birth, and even during breastfeeding, more so when it comes to the HIV infection. Yeah. So in the first trimester, we want to screen the mother for all that. We want to get to know their past obstetrical history, their past pregnancies.
How was it?
What happened? What illnesses did they have? Yeah. How was their birth? All that. We want to start it, here at the very first time. Because we want to handle this mother as a unique person just from the word go. Yeah. So that you're able to give them the next visit knowing who you're handling. Yeah. Now that is with the do's. And now with the don'ts. Self-medication
is number one. You get a headache and then you say, let me take my Panadol Extra because it works faster than the Advance.
Exactly.
Let me take my Peroscam. It is better. I won't get that headache again.
You don't know the kind of damage
that you're causing
to this
little one
who is, just trying to
grow.
So self-medication is totally prohibited. That one is out. Anything you feel you're not okay, you're supposed to walk to
a facility
or contact
a doctor,
health professional. Yeah, because at least for us, we know what is recommended in pregnancy and what is not recommended. But for you, you may not know. Just like you said, even a mere Panadol. Yeah, like because Panadol, it is hard to find a home without a Panadol.
Yeah.
So you may think, but you can never know what it can cause
to the baby.
Yeah. Then secondly, we wouldn't expect a mother in the first trimester, yeah,
to be overworking,
to be overwhelmed with work, heavy work, carrying heavy loads. Yeah, you are at risk of a miscarriage.
Wow.
Yes. You are at a risk of a miscarriage. Yeah. So we wouldn't encourage a mother at that stage to be doing that heavy work. Yeah. We want you to rest as much as possible. Yeah.
Or if you're a working class mother, you can get leave.
If possible. If possible. Though at times, just like our workplaces, it may not be actually possible. But we are encouraged to inform our leaders at work early enough, yeah? Because even at work, there is that other work that you can be assigned, yeah? Besides this other one, yeah. If you let them know, they can always be like, no, according to Annie's situation or Sheila's situation, I think for now, let us relieve her of such duties so that she can be doing this other work.
Okay.
Exactly.
Well, you're watching U24, and of course today on One-on-One we are talking about antenatal care. What is the importance of antenatal care? What are the do's and don'ts? What happened if you don't do antenatal care? We're going to be asking, actually, sister, I wanted to ask you, what if a woman doesn't do antenatal care? What happens to them?
Thank you, Sheila, for that question. Now, you see, from the time we started, we have been talking about the importances of antenatal care.
Yes.
Yeah. Now, just look at a mother who missed out on their folate in the first trimester. Yeah. And we are saying folate is important,
very important
for brain development and spinal cord development. Yeah. So you see what this mother is missing. Yeah. That is one. Two, remember, when we go for antenatal, we screen the mother. We handle the mother holistically. Yeah, we do examine them. We do some laboratory tests. We do some scans. Yeah, we do give them supplementations. We do vaccinate them. Yeah.
Is it important for, okay, I think I'll ask that. Yes, you've hinted on something that I really wanted to know.
Okay.
Yes.
Yeah. So if a mother does not really go for antenatal, they are going to miss out on a lot, and they are actually risking their lives and the lives of their babies. Yeah. Because if you don't go for antenatal, you may not be able to know
the importance
and those other conditions that you could be having within you, and maybe you didn't know, because sometimes pregnancies precipitate those conditions and they are able to come out. For example, high blood pressure. We have people that have high blood pressure that run in their family. Yeah. So for you, you may be okay when you're not pregnant. Yeah. And then kaboom, you become pregnant
and you get
the pressure comes up.
Yes.
Yeah. So that is why in antenatal we take all that family history. Is there anybody in your family
that has pressure?
Yes. On your mother's side? Is it on your father's side? Yeah. So all that, we are preparing you as a person. Yeah. We want to know, and in case it happens, we look at your antenatal card and we're like, oh, okay, they have history. Oh, okay. If there is no history, okay, now this has just come, and then we need to know how we are going to go about this. Yeah, exactly. So there are certain things you may not know. For you can be walking around and you feel you're normal, everything is okay. But when actually
you're not normal,
you're not
you're
normal.
very sick.
You're very sick. Yeah. So antenatal goes ahead and finds out about all these. Yeah. And we are able to intervene in real time. Yes.
Let's talk about high blood pressure before I go to the services. That what kind of services do we get? Let's talk about high blood pressure and probably maybe low pressure and maybe diabetes. If a mother walked in when she's diabetic, what kind of treatment does she get on antenatal? And the mothers that walk into hospital when they are, hypertensive, and those that have, low blood pressure, what kind of medicines are they supposed to take? Do they continue with what they've been taking, or somehow, somewhere, their medication changes? Okay,
thank you so much, Sheila. For mothers that are already known high blood pressure and diabetic, we definitely handle them different as of these newly diagnosed mothers. Yeah. So there are some medications that are recommended during pregnancy, and those that are not recommended. Yeah, during pregnancy. So usually what we do, we check the mother if they have already been on antihypertensives, those are pressure drugs. We look at what they have been taking, and then we see if it is safe in pregnancy, we let them continue. If it is not safe in pregnancy, we shall take it away and give them what is safe
for them.
And there are those that can be already on a drug and it is working for them.
They continue?
It is already working for them when they are not pregnant, but when they become pregnant,
it doesn't work.
It is not working well for them. So it does not matter. So however much they have been taking it and it is safe in pregnancy, if it's not working for them, we can as well switch to another one.
Then later when they give birth, do they go back to what they've been taking, or they continue with this that has been given to them as a new drug?
Now that one depends on their physician.
Okay.
It can really depend on their physician. Because for us in the gyne and obstetrical department, now what we are looking at is the mother and the baby at this time, because now for us this is our specialty.
Yes, yeah, the unborn baby.
And the unborn baby. So when the mother gives birth, and there is that what we call the postpartum period or the puerperal period, that is 6 weeks after delivery. If we discharge this mother and they're okay, usually we tell them to go back to their physicians. Yeah, because now it looks like our part now is done. Yeah. So now we are again referring them back to the specialist now to take over. Yeah, in that more of that medical illnesses. Yeah. So if they see that this drug can still do for them, they can continue with the drug, or they can choose to switch them back to the other drug. Yeah. So it depends on their physician.
Okay. Now, sister, the services that they get during antenatal, what are some of the services? You hinted about vaccination. Why is it important? And for a mother who has not yet given, to the unborn baby to get vaccinated, and maybe if you hit for some of those, little services that mothers get during antenatal. Okay.
Now, one, we do screening of a mother. Yeah. Secondly, what do I mean by screening? Screening, we do those several tests. Yeah. We screen you for HIV, hepatitis, for syphilis, malaria test. Yeah, we do a urinalysis to check for your urine. Yeah, so we do screening of those infections that we see that can be passed on to the baby even when they are intra-utero. Yeah, that is one. Two, we do supplementation.
Which is very, very important.
Which is very, very important. Yeah. You could be having a good blood HB when you're not pregnant. Yeah. But remember, when you become pregnant, you're now sharing with somebody.
The baby.
Exactly. So that blood HB may not be enough for the two of you. It will not actually be for the two of you. That is why we go ahead and supplement you by giving you these irons. Yeah, because now after the first trimester we also introduce the ferrous sulfate, and then we give it in combination with the folic acid and the ferrous sulfate in order to boost your blood HB. Yeah. Then we have to deworm you. Yeah, we don't want worm infestation in a pregnant mother, because remember, what you take in is also your baby
is taking in.
Exactly. So if you're having worm infestation, that means the baby will not be able to get what they are supposed to get. Yeah. And then thirdly, we do preventive measures. We prevent you for malaria. Yeah. Just like for us here, malaria
is very key.
Exactly.
It's one of the most.
We do that presumptive treatment.
Do women still take Fansida?
Yes.
Isn't there any other drug that has come on the market?
No.
Apart from Fansida?
We are still using Fansida. We are still using Fansida, and nowadays it is a directly observed therapy. In that you take it, swallow. When I'm saying it. Because we got to know that when we give it to the mothers.
It's so weird. The tabs make you very sick, make you very weak.
Yeah.
You literally can't, if you're driving, you can't drive back home. Yes.
Yeah. But, okay, nowadays, however much we say that we have to do it, yeah, when somebody is saying, but nowadays we have come a bit, a bit loose, in that when a mother explains to you that, what,
when I take
Fansida,
I get this and this and this
and this and this, and yet I have to drive back, and maybe I'm driving back to work, and all that. So you have really to convince us that when you go home,
you will take it.
You will be able to take it. And at the end of that day, we shall also tell you the importance
of you
taking the Fansida here. And we shall tell you that in case you don't take the Fansida, if you lie to us, one time we shall get to know.
Because you will get a fever at one point.
Exactly. So we just let you know, and then you take your Fansida home with you.
But some of us are blood group O, so we are proud of we don't get those diseases.
Who tells you, Sheila? Who tells you?
Yes.
Yeah. So, so we shall tell you the importance of you taking your fansida, and then maybe you take it at. But we encourage a mother to take it from there, because we got to know that
Mothers.
most of the stillbirths we were getting, according to research, were because of those malarias that mothers were getting, yes, during pregnancy. And reason being, mothers were not taking their fansida well.
What is stillbirth? Thank you for talking about it. If we could just hint about it small.
Yeah. So stillbirth, this is a baby that dies in the womb, in a layman's language.
Omwana yanfiiridde mu lubuto.
Omwana yanfiiridde munda.
It's caused because of a fever?
There are so many other things, but malaria is one of
them.
the causes.
Wow.
Yeah.
To the ladies out there, I think it's a must for us now to go for antenatal, because Sister Annette is really hinting on the very important things there. So it's very important when you take it, it can, reduce on the stillbirth.
The chances
are very high.
Yeah, it reduces on the chances of you getting
the stillbirth,
and those other complications like premature deliveries. Yeah, because in most cases, if you get malaria in pregnancy before term, what happens is a premature delivery. And you know what happens with the premature delivery?
Oh my God, a lot of expenses there.
A lot of expenses.
Yes.
And then you're like, shall we make it?
Shall
there
we
are even
not?
chances of even not making it. Yeah. So that is why we are saying you take your medication as recommended.
Sister, something that I wanted to say, there's a hospital that I'll not mention, it's a government hospital. If you go for antenatal without your husband, bakugoba, they say, please go back home and pick your husband. To an extent, some women would get border men to escort them. Or if I have a colleague of mine here, I can tell, my colleague, I say, Tyson, please escort me, but he doesn't know why he's escorting me. And I tell him, we're going to go to antenatal, but you're going to pretend that you're my husband. So why is it important for one to, walk into antenatal with their partner?
So that is what we call male involvement. Male involvement, Sheila, from the word go,
is very important.
It's very, very important. One, just that psychological support from your partner, it adds a lot. It really adds a lot to this pregnant mother. To feel that there is somebody for me. I'm not in this alone. Yeah? And then two, we want this male partner to come to the health facility to get it from the horse's mouth. Remember, previously we talked about the do's and
the don'ts.
And the don'ts.
Yes.
So we want this male partner to hear it from a health worker, from a health professional, yeah? Because there are some male partners who are like, omukazi yekoza, omukazi okuva yafuna olubuto yekoza, simutegeera, because they are saying, I'm weak, I'm not able to do ABCD, or my midwife or my doctor said I'm not supposed to do ABCD. Yeah? So to them, they take it like a scapegoat, that maybe this woman is just pretending. But when they come to a health facility, they are able to get to hear it from
a health worker
that, you know what, your woman is pregnant and expect ABCD. In the case of nutrition, education, they need to hear it, that we expect you to support them when it comes to nutrition. We expect you to do ABCD. We need them to understand the reason as to why this mother should come for the antenatal visits. They should respect their visits, yeah? So that when the time comes and they're like, I have to go for antenatal, they are able to provide for them the transport that they need. Then another thing, we also want to screen this male partner to see if they are okay, yeah, health-wise, yeah. More so for the diseases that we know that can be passed on, yeah, maybe through sexual transmission,
yes.
Yeah. So we want also to screen them because we could be handling the mother, yet even the male partner
is a problem at home.
Is a problem at
yes,
home, yeah.
Yes.
So we also want to screen them, yeah. We want to do their HIV test also to get to know how they are standing, yeah. If they are seropositive, we also get them on treatment, yeah. If maybe they are having syphilis, we also treat them, yeah. So that we just don't only handle one part, so that we handle them holistically as a family. Yeah. So
those are some of the things that why men should be involved in the antenatal.
Exactly.
Sister, as we are winding up, I can see we have just a few minutes to the end of the show. Let's talk about the birth. Sometimes we walk into a healthy facility and then they tell you, you won't be able to push, and then other, mothers make a lot of noise. What do you have to say about that? The birth, what kind of births do we have, and how can we, forego about them?
Okay, so when it comes to birth, that is why still we go back to the importance of antenatal. Because we are able to screen this mother and get to know. We are able to examine the bones, the pelvic bone, because that's where the baby passes. So we are able to know. Actually, as the mother walks into the health facility, for us, we start taking our assessment. Yes. When this mother is walking, are they limping? Because usually if a mother is limping, then you just know even their pelvis is not a normal one.
Yes.
It's a contracted one. Yeah. Are they short? So that means even their pelvis is short. So they could not be able to give
birth.
A normal birth. Yeah. And then we go ahead and examine at around 37 weeks, because at this time we don't expect the fetus to add so much weight. Yeah. Yes. So we are able to relate the passenger and the passage. So the passenger is the fetus. Yes. That's the baby. Then the passage is the pelvis.
Yes.
So we go ahead and we do what we call a pelvic assessment. We go into the mother and we do a pelvic assessment to get to know whether their bones are good
or they are not good,
or they can be given a trial.
Yes.
Yeah, when it comes to birth. So and we tell the mother that your bones are ABCD, we may expect a normal vaginal birth or a cesarean section. Yeah. So when we go for the trial, the mother already knows that I'm just trying out this. If it goes on, if it fails,
then I go for
C-section. If it works out, then we thank God. Yeah.
You talked about postmortem. Is it that after giving birth, why is it important? Yes. Yeah. Why is it important for women to take off some time, or maybe I thank God that I still have a mother. And if I think to my case, if I didn't have my mother when I gave birth to my firstborn, I would have gone through so much, straight to an extent of saying, I don't want this child anymore. But as a mother, I think she knew, and she's like, maybe my daughter is going through how did I call it?
The postpartum period or
yes.
the puerperium.
So, what do you have to say about that as we wind up? Yes.
Yeah, so it is very important, Sheila, because remember now your body is recovering. Carrying a pregnancy for 9 months, it's almost a year.
Yeah, yes, true.
Yeah, so your body is really tired by this time, and now everything has to go back to normal. You remember our uterus before we conceive is down here in our bones. Yes. Yeah, and now it comes up. Yeah, so now this is the time the uterus has to go back to its normal position. Yeah. And everything, the body, the hormones, to go back to normal. During giving birth, we bleed, so we need to replenish. We need to
eat well.
To eat well, we need to sleep enough.
I have one obwana
bukaaba but kyova olaba tuba twagala male involvement wano mu antenatal awo wonna tubategeke kubanga ne abaami babawaayoko ku paternal leave at least for those 3-4 days.
Yes.
Akubeererewo akaana bwe kaba kakaaba akuyambeko okasirisa that is bwe kabanga all is well, bw'omanyi omwana akuse bulungi, sigamba yeetaaga kukyusa dayipa ng'omanyi just kyakaaba maybe because of colic. So that is why tuba twagala nnyo abaami batubeererewo nti akukwatireko ku mwana oyo, maama naawe owummuleko. Oba si kyo ofunayo omuntu kati nga bw'ogambye waliko ewa mami.
Yes, mommy was there for me. Exactly. I really thank my mom. She was there when I gave birth. Wow. My baby would cry from like starting 11 and I would feel so frustrated. And my mom would say, no, you give me my granddaughter. It's okay, you sleep. And I would feel now my mom, you're more pressure than me. So...
And because she has been there before, yes, so she knows exactly what it means. So we really need that family support. We need those people around us who can really understand that, oh, Sheila has been going through ABCD. She's now going through this period. So we need to relieve her so that her body can relax, and even your mind, yeah? You know, that whole situation, sometimes it can even organize you mentally. Yeah, so you really need that support. Mutoyi kale kakaba ke kamanyi, you know, because nayo bikutamye, jukulobadde neno stress yonna ino olubuto wano wonna mu kuzaala, that is all stress. Yeah, so sometimes even some mothers end up going into mental, you know, health, yes, mental issues. Yeah, what we call postpartum psychosis. Yeah, just because of all that, or what we call postnatal blues. Waliwo buliddeko abakyala n'azaala ate n'ayagala ate okulya omwana we, things like that. Yeah, so kati ebyo byonna ka psychosis ako kajjawo because mukyala abadde byadde ayitamu bingi, now this stress of giving birth, so somehow mukyala atuuka n'abanga avuddeko. So if they don't have that someone to care for them, to give them that emotional support, balaga no, it's okay Sheila, all is going to be well. Kati gwe weebake omwana nze kamusitule. Yeah, so maama ono tuyinza okumaliriza nga ate somehow tumufiiriddwa ate mentally. And so that is some other work okulaba nti tumuyambako with treat and all that to bring her back to normal. Yeah.
All right, sister, as you look into our cameras, what would be your last remarks to the expectant mothers out there and those that you know, willing to get pregnant? What would be your last words?
Okay, thank you so much, Sheila. Now, to my mothers out there, yeah, I want to tell you that we love you so much, because these people you're carrying, or these people you expect to carry, are the leaders of tomorrow. So my dear mothers, my sweet mothers, kindly, please respect the antenatal visits. Now that we have shared the importance of antenatal, please, we are begging you, don't take antenatal for granted. Antenatal is for your own good, and for your baby, for your family, for the country at large, and the world at large. So please, I want to encourage you to always go for antenatal visits as scheduled by your health worker, and to always do what your health worker has told you to do, so that at the end of the day, we walk this sweet journey together and we get those good outcomes. You know, Sheila, there is nothing good. There is nothing that makes a health worker happy or proud like having a good outcome.
That is very true.
So for us, that is our prayer and that is our satisfaction. So we really feel good when your mother, the mother you saw walk into antenatal, now gets out with their babies, all healthy and happy. So that is my message and my outcry.
Thank you so much, sister, for coming. I will be bringing you, to enlighten more. There are certain things that we haven't hit on. Maybe what happens in the normal delivery, what happens in the C-section. We'll have you again so that we can finish this topic. But thank you for coming. Send our regards to the doctors of Chisubi Hospital. And,
you're most welcome.
We love them so much.
You're most welcome, Sheila, and thank you for having me here
You're
today.
welcome, sister. Thank you so much for being part of this beautiful show, all the way from the hour of 10. And We've talked about the importances of, you know, antenatal. Maybe a few things that we have not hit on is about, you know, the normal delivery and the C-section, what happens there. We'll have, you know, sister come back and to explain to us more. To the men out there, you've heard my producers, please go with your women to antenatal. Do not leave them, go with them, you know, experience this journey together. And to all the men out there, walk the talk and the journey with your wife in this antenatal. She might not be your wife, but even though she's your girlfriend, walk the talk. Let's go together for antenatal. Let's get screened together and get to know the statuses and how we are standing. It's raining outside. Fresh and Clean is, you know, here to give you the latest music, the latest Lugambo. So you know, sit down and chill. It's, you know, keep on U24 as we give you the latest in music and the other programs that will be coming on. DJ Shamo is around, so we're going to hear some beautiful music, so you can send in your requests and they'll be able to play them for you. But thank you so much for being part of this. You can still follow our conversation on our you know, YouTube page, which is at U24. TikTok, we're live there as well, and Instagram and Facebook. Follow and, you know, listen to this talk that we talked about, mostly to the expectant mothers out there. Have a lovely day. God bless you. We'll do this again next week, same time, right here on YouTube.